Hello everyone, today we're going to be talking about sensitive teeth and if you should be using a product like Sensodyne.
Those are delicious.
Well, thank you, my child. I made them by hand. Okay.
This is Dr. Tamisha Denis and this is The Modern Smile. When I meet someone who says that they have sensitive teeth, I usually go through a series of questions with them. Do you have sensitivity with hot? Do you have sensitivity with cold? Do you have sensitivity when you have something sweet? Do you have sensitivity when you have something acid?
Drink this liquid.
More, please.
Do you have sensitivity when you bite down on something? All of those symptoms mean something. And I have another video that talks about what your symptoms mean, but today we're going to focus on sensitive teeth. The reason that we have to make a distinction between sensitive teeth and having symptoms of tooth pain is because sensitive teeth is different than having tooth pain. So, if you look at the back of any Sensodyne label, you'll see if sensitivity persists, and I think they say 2 weeks. If sensitivity persists for longer than 2 weeks, seek professional opinion of your dentist. And the reason that is because at home, sometimes we cannot distinguish between is this tooth sensitivity or is this tooth pain.
Thought you ought to know.
Now, if you go to a dentist and you don't have any cavities, you don't have any broken teeth, you have no abscesses, no infections, no gum disease, essentially nothing wrong with your teeth, you may have something called dental hypersensitivity. And that just means that your teeth are sensitive for no obvious reason. And the reason I say obvious is because there are other reasons that your teeth can be sensitive. For example, some people have the bad habit of brushing too hard. So in their mind, they think that if they brush really, really good, that they're cleaning better and therefore they'll have a healthier mouth. But sometimes it can cause an opposite problem, and we call that toothbrush abrasion. That means all of that scrubbing of your teeth, and I usually find that people do that with manual toothbrushes. That means just a regular old toothbrush. They tend to do a lot more scrubbing. So when you scrub right along the gum line, you'll start to form recession. And recession just means that gums start to go away from the tooth and expose your root. And if you have root exposure, that part which is supposed to be covered by the gum gets very sensitive, especially to liquids. So if you have something cold to drink or a warm cup of coffee, you'll notice you'll get that chill that runs along your teeth.
More coffee, hon?
Yeah, just keep it coming, please.
Sure thing.
People also with gum recession or toothbrush abrasion will also notice that when they brush their teeth along the gum line, they'll also be sensitive. So the most important thing is to not cause yourself unnecessary harm by brushing too aggressively, because you can brush really well without scrubbing. My advice to people usually who are brushing too aggressively is that they should probably switch to an electric toothbrush with a sensitive head. I personally use an electric toothbrush with a sensitive head. My favorite is the Oral-B, And it also has a little diamond trigger that goes off when you're pushing too hard. Now, some people have just begun to do that recession. And if they've just begun to start having a little bit of recession, then they can use Sensodyne to help calm those areas of where the recession is. But sometimes if the areas start to become very notched out, we have to put a filling to cover the piece of tooth that you've lost by scrubbing too much. Another reason that you can have sensitivity because you have gum disease. That's another way that you get gum recession. So what the gum disease does, it destroys your bone around the tooth and makes the gums recede from the tooth, exposing the root of the tooth. Now that can be very, very sensitive in addition. And again, if you're cavity free and you have really no dental issues, Sensodyne is also a good solution to help calm that tooth. Another reason that people will experience sensitivity is if they use certain whitening products. Now, whitening is notorious for causing tooth sensitivity, and that's because depending on what kind of whitening it is, it will do either one of two things. If it's a chemical whitening product, which is hydrogen peroxide or carbamide peroxide or other whitening agents, it also opens up the pores of the teeth to allow the whitening to penetrate and pull those stains, and that can cause a lot of sensitivity. So usually if I have a patient that we're doing in-house whitening or take-home whitening, I tell them use Sensodyne exclusively during the time that you're doing your tooth whitening. Now, there's another kind of whitening that I do not like, which is abrasive whitenings. That means that the whitening agent has these micro beads that scrub the tooth, and as they scrub the tooth, they're removing enamel. So we talked a lot about the root being exposed, but another thing that causes sensitivity is something we call dentin. So you have the enamel, which is the first layer of the tooth, which is the white part that you know, and then you have dentin, and that dentin is not meant to be exposed. It's very sensitive. After dentin is the pulp, the nerve. So imagine you go through the enamel, into the dentin, now into the nerve, and the closer you get to the deeper parts of the tooth, the more sensitive that tooth will become. So when we're using agents that are abrasive, either through brushing or through micro beads in a toothpaste, or even a cavity that goes through the enamel of the tooth into the dentin, that's where we get sensitivity. So if you're using a toothpaste that has micro beads or micro abrasion, this is not like your skin. So you say scrub, scrub, scrub and get all the dead pores off your skin. You do not want to remove enamel. And artificially, not naturally, can you make the enamel grow back. So once you've lost it, unless a dentist is going to repair your tooth with a filling or a crown, you will not get it back. So what Sensodyne does, it infuses the pores of the tooth with something called potassium nitrate so that it can block the liquids and everything from causing your tooth sensitivity. Unfortunately, teeth only feel one thing, and that's pain. They don't know how to feel, ooh, that feels so cool and nice, or ooh, that's so warm and cozy. Teeth only know how to feel pain. So basically, you're either feeling nothing or you're feeling pain. That's it. That's all teeth know how to feel. It blocks the pain signals that enter to the tooth and cause pain to keep your teeth from feeling those highs and lows of the things that you eat. Basically, it's a physical barrier that covers up those little tubes and keeps the pain signal from going through the enamel into the dentin, into your nerve. Usually, if you use sensitive toothpaste for about 2 weeks, you'll start to feel the difference. So if you have to avoid ice cream or avoid your cold drink or your iced coffee or a slushie or a hot cup of coffee or a warm soup, that means maybe you should consider using something like Sensodyne to help you enjoy your foods again. And what are teeth for? Better to enjoy food. I hope you learned something about Sensodyne and when it's appropriate to use it because you really have sensitive teeth or you have a dental issue. So just make sure you're responsible. If you have pain that persists, go and see your dentist and at least find out what's going on, because that's what we're here for. And if you like this video, make sure that you give it a thumbs up. So subscribe to the channel. Thank you for watching.